Hi, my name is Dawson Fry, and today we will be talking about mental health issues in children with a specific look at the later adolescent years, which is 15 to 19 years old. So, this age group has seen a drastic increase in the amount of mental health diagnosis over the past couple decades. And a lot of this has to do with the fact that everything nowadays is at like the fingertips on your phone. We see all these influencers on social media who live much different lifestyles than the average American does. They're different socioeconomic statuses, and it puts a lot of pressure um, on these adolescents to try and fit in. They see their friends out doing something and they wish, why am I not doing that? And also, this comes with a time of like they're moving out for the first time. They graduate high school. They're moving out to college, and they're finally learning who they are as themselves now that they're not underneath their caregivers anymore. They can kind of explore themselves, whether that's sexually, spiritually, morally, anything like that. And so with that comes a lot of stress, trying to conform to today's societal norms. And so with that, there becomes a lot of, am I doing this right? I'm not doing enough. It adds a lot of stress on top of a lot of people end up going into schooling, and school adds a lot of stress. People get their first jobs, they move out, they have bills. It's a lot of life altering events that happen in life, and this can be very stressful, and sometimes it just gets the best a lot of times. And we've seen in the 15 to 19-year-old range, depression is the fourth leading cause of mental illness, and anxiety is the ninth leading mental illness amongst this age group. And so with that, there becomes an increased risk of suicide, and actually suicide is the third leading cause of death between 15 and 19-year-old kids, because of these mental health issues that a lot of times go unnoticed or undetected because they also don't want to really open up about how they feel. They have a hard time doing that. So with that, there needs to be more resources available for this. And so there has been a bill in the Senate that just passed last month. It was Bill S-1585, which was about making sure that it was mental health resources available for students. And with that, it was introduced by John Kennedy of Louisiana. And with that, it would require that the institutions here, like colleges that receive federal funding, have to provide either on their website or on their student identification cards the numbers to like the crisis text line, the National Suicide Prevention Hotline, and the mental health like counseling phone numbers on the back of student IDs or on their website. And with that, it makes it that these students have an out, to that somebody is here that wants to talk to them, and that they're not in this alone, and that they have this resource that they might not have thought of beforehand. So even, for example, at the University of South Alabama, on the back of their student ID cards, it said there's a number for USA Counseling. And so with that, you never know when somebody is, down on themselves, depressed, thinking about suicide. And so just making sure that these resources are available for them really can save lives in the long run, because they can reach out and get the help that they need, even if they don't want anybody else to know it. And so it's passed the Senate, and now it is on to the House of Representatives for the committees to look at it. So, and with that, just thank you for your time.